The number of patients, the number of deaths over the last few weeks is heart-wrenching.
The second wave of COVID appeared as an abominable episode in the history of India that took away many lives.
On Saturday, India saw the world's highest ever case tally of over 400,000 infections.
For many socio-economically marginalized families, this was a major blow to their sustenance. Access to healthcare had also been on the fringe. This spike soon came to an end, but then followed a long journey of recovery for the communities hit by the deadly virus and a fear of the next wave. Is home to myriad communities with vibrant culture and traditions. They depend on the forest, nature, and traditional healing mechanisms. Farming and cattle rearing is the basic means of livelihood, along with some low-paying jobs to generate supportive income. Amidst many communities, access to basic healthcare is very minimal. The subsequent waves of COVID and the lockdown rattled their sensitive communities socially, economically, and emotionally.
COVID-19 pandemic was an unprecedented humanitarian crisis. Caritas India, being the humanitarian organization for humanitarian assistance, we wanted to be very strategic as this was a new form of crisis.
Caritas India has been working amidst these communities for a very long time. Along with Caritas Italiana, the program was executed to help communities restore from the aftermath of COVID and to prepare for any upcoming pandemic.
So we worked on a multiple strategy: be cautious, be trained, be connected, and be compassionate. Collectively, we responded to almost 25 million people in the country. We reached out to almost 72,000 people, providing them medical and hygiene kits and also extending fund support to get them back to their work through livelihood support mechanisms. Added to that, we had undertaken massive awareness campaigns.
Mobile vans with loudspeakers were driven across villages. In targeted villages, demonstration on use of hygiene methods and pamphlets with key information about COVID Appropriate Behaviour was also shared. As a response to the catastrophe of the second wave of COVID, Caritas India, with the help of local partners, reached out to these sensitive communities to help prepare them for any COVID-related emergency in the near future.
తగ్గినంత వరకు దాని కోర్స్ వాడటం, రెండోది మాస్క్ పెట్టుకోవడం, దగ్గేటప్పుడు తుమ్మేటప్పుడు
जसे आपली मास्क घालायची नांगली तसे हात धुवायची पण काहीतरी पद्धत आहे.
The other part of the strategy had been to help vulnerable families recover from the crisis. The idea of fund transfer had been inventive. Most of the identified persons for the unconditional fund transfer programs are daily wage earners. Without financial security, there is always a fear of emergency looming around. Take the case of Philip Tirki, who used the amount to treat his wound injury caused when he was attacked by a wild animal in the forest.
और अभी तो हम क्या बोले रेजा ही कुली करते थे तो 1.5 लाख हमार बहुरिया घबराए गेलक और कहलक कि हम इतना कहाँ पाब। फिर भी वो आए के कोशिश करलक, खीने आलक जे कि तुहिन का फंड देने से हमके जे मिल रहे से नाक बैठाने के लिए यहाँ से लिया, निकाला, यहाँ से जॉइंट किया और यहाँ से फिल्टर किया था, यहाँ से नाक बैठाया था, लेकिन नाक सक्सेस नहीं होने के कारण से कहने का मतलब अभी ऐसा ही है।
It's a long road to recovery for Philip and his family. Just like him, many of the family used the fund for their sudden medical expenses. For many others, it was an opportunity to start small businesses to mitigate the financial crunch they had to face during COVID.
सबसे पहले तो अभी बच्चे लोग का किताब सब लिए कुछ पैसे से ना, उसके बाद में यही सेकेंड हैंड में मशीन सब लिए। ये दीदी लोग भी सभी पैसे कुछ कुछ मिलाए कि सभी इकट्ठे करके दीदी का पैसे से वो खाने वाला सामान लिए, एक दीदी का सलवार सूट रखे हैं, वो कपड़े रेडीमेड लिए, पेटीकोट वगैरह, फिर सूट।
जैसे कोई शहर जाने नहीं सक रहे हैं और यहाँ पर आके अगर देख रहे हैं कि यहाँ पर हमको मैचिंग का सामान मिल जा रहा है कपड़ा के साथ पहनने के लिए, वो चीज़ यही से
तो अभी सोच रहे हैं कि जो भी छोटा मोटा है ना तो वैसे और बड़ा हो जाए।
The COVID times were very challenging for the communities. Being a handicapped person from the already economically weak community becomes a greater disadvantage. Rupesh lives in the Silonda village with his family. Despite the challenges, Rupesh manages his family well.
मला थोडं हे भेटलं, सांगितलं का मदत आलेली आहे, तुम्ही काय करू असं मी थोडा विचार करत होतो। तरी मला सिस्टरनी सांगितलं कोंबडी तरी घेऊन बघा, ते कोंबडी मी घेणार पण एवढे त्याचं चाकरी करणार असं त्यानं, ठीक आहे मी करून बघतो, चालू केलं, जमतं मला तर काय नाही। कुठून कोंबड्या आणले ते घेतले, 40 कोंबड्या घेतले, त्याच्यातून 1-2 चावल त्यांचे खाणं घेतलं, नंतर परत दुसऱ्यांनी विकत घेतलं आणि परत
మా ఫ్యామిలీ 5గురు ఉంటామండి. పెద్ద అబ్బాయి పాలిసెట్ చేస్తున్నాడండి, చిన్న అబ్బాయి 9th వెళ్తాడు, పాప పూర్తిగా అన్ఫిట్ అండి, ఇంకా నుంచి కడుపులో ఉన్న కాడి నుంచి
డాక్టర్ గారికి అయితే దీని పరిష్కారం లేదండి.
పెద్ద అబ్బాయి పాలిసెట్
ఆయనకి
తాడేపల్లిగూడెంలో సీట్ వచ్చిందండి, ఆ అబ్బాయి కోసం
పంపడానికి, ఇక్కడ పరీక్షలు రాయించడానికి, ఆన్లైన్ పెట్టడానికి, అవన్నిటికి కలిపి మీరు ఇచ్చిందని టీచింగ్ చేస్తూ అలా తీర్చుకుంటారు ఎడ్యుకేషన్.
Hundreds of families are restoring their lives after COVID. The animators and facilitators provided continued support to the communities. communities that live in harshest areas of India. In a span of 12 months, the program had been immensely successful. With the efforts of the volunteers, field coordinators, state coordinators, and head office staff, the program has impacted communities that had been unfortunately affected during the dark times of COVID's second wave. Though this is not the end-all solution to the crisis, efforts are ongoing with similar programs to help the communities reconstruct their life and livelihood.